Good afternoon, Dr. Maria.
Hi, Servan.
Thank you so much for conducting once again the hands-on part of our aesthetic fellowship here in Dubai at your premises, A4M Aesthetica Clinic. So you have been involved with A4M now since November 2011, when we first started to introduce the hands-on at your clinic. Can you tell us why, as a physician and as a continuing lecturer, you believed in the importance of conducting a fellowship training in Dubai?
Well, first of all, I have a background in academia. I used to teach at a medical school for many years, so it's always been my passion. And furthermore, I feel that the field of aesthetics is expanding at such a fast rate, and there's so many procedures out there that it's important to impart the knowledge about evidence-based procedures that work in our field. And because there is a growing interest, we want to ensure as much as we can and contribute to creating higher standards in the field of aesthetic medicine in terms of practitioners worldwide. And I feel the A4M is a great platform that allows us to do so.
Thank you. So we have brought to your clinic physicians from around the world so far. In this course today we've had people from Southeast Asia, we have people from Europe, we have people from the local region.
Yes.
So it must have been an enriching experience for you. Can you tell us a little bit what has this course and the participants taught you in a way, because this is a mutual experience for everyone?
Yes. First of all, what is really very obvious is that across the board, all the participants have a passion for what they're doing. And this is very gratifying for us to interact with people like this. And we always learn from people and their experiences. So it's been very enriching for me in that respect. Interacting with them, see how they fine-tune these procedures in their countries and how they, optimize their treatments. At the same time, every time I lecture and I prepare my lectures, I research more, I learn more. So the best way to learn, obviously, is to teach. So for me, that's what's been really gratifying.
And the skill set that we are teaching in this fellowship is very broad. So we have some beginners who have never injected in their lives before, but we also have some rather experienced dermatologists.
Yes.
We also have people from different countries, as we have said, with different cultural norms and expectations. So how has it been for you teaching people with such a broad skill set and cultural backgrounds?
Yes, it's been very exciting, but first of all, what we try to do is we try to group people according to their proficiency level. So for example, beginners would be taught separately, and for them the important thing is literally to break the ice and start to inject. And this gives them the confidence then to go on and venture on their own. In terms of the more experienced people, they have different objectives. Some of them just want to see how it's done somewhere else, because at the end of the day we each have our own way of doing things. Others want to learn more advanced techniques. For example, they might have been using fillers for a long time, but might not have been so adept at facial contouring, combining procedures to optimize facial shape. So they might want to go more into that. So we try to find out ahead of time what their specific interests are and address them as much as we can on an individual basis.
And going forward, the A4M is obviously an organization which is very fast moving and is always developing new programs to cater for the new procedures that are coming up. So what are your plans with regards to the fellowship in aesthetic medicine, and how do you envisage that we will be able to develop this further in order to cater for the growing demand that we have from physicians?
Yes, what we want, what we would like actually is, apart from the core modules that we teach for the A4M, again with the A4M, to tailor specific targeted courses in more advanced procedures such as laser liposuction or vaser liposuction, things like hair transplantation, and to be able to cater for people that are interested in those specific procedures per se.
Well, we very much look forward to developing these programs with your very much valued assistance, and we thank you for all your hard work.
Well, thank you very much.
Thank you.
Thank you.